So let's talk a little bit about some of your results and particularly which medications might be associated with better, worse, or the same outcomes, that sort of thing. That's a lot of questions that we're getting from the audience right now. Um, the two that keep coming up, so prednisone, if one of you can comment on what's happening with prednisone and steroids and what you think about why it might be a high risk drug. And secondly would be the biologics. And the question that keeps coming up is about infliximab or Remicade, Renflexis, Inflectra. Um, and both, does that increase your risk of developing complications from COVID, which I think you discussed a little bit earlier, Mike, but if you can repeat that. But also, I think people have heard rumors of biologics being tried to treat COVID. So is it possible that Remicade is actually making things better?
Erica, you want to start?
Yeah, so those are all great questions. First, to tackle the steroid question. So we have seen, at least trend-wise, and again, these data are still preliminary, but we are seeing that individuals who are on steroids like prednisone are at a higher risk of having severe outcomes and at a higher risk of death from COVID. And while we can't definitively say why that is the case, overall, steroids are a pretty big gun, and they sort of hit the immune system from multiple angles as compared to some of our other medicines, like the biologic medicines like Remicade, that is more specific to a certain part of the immune system. But the exact mechanisms or the way that that's working, I think there are a lot of smart people thinking about that question right now, but that's not something that we can definitively answer.
I'll add that the prednisone bit was not a surprise finding. This is a story that we've seen before. No matter how you look at it with any type of infection, ranging from pneumonias and other bacterial infections to viral infections like herpes zoster or shingles or influenza, steroids do appear to be a risk for more severe outcomes. And I think Gil mentioned the second point in the beginning of the session today. Leaving IBD out of it, it was initially thought that treating patients with significant lung involvement from COVID with prednisone would be a good thing to reduce the inflammation in the lungs, but it turned out that that didn't work either. So I think from a general infectious and IBD risk, as well as the specific COVID-related thing, prednisone does not seem to be helpful. The second part of your question, Eric, was about the anti-TNF medications and the Remicade, and that story I think might be a little bit surprising. At least from the data that we're seeing in this registry, it does not appear that anti-TNF increases the risk of more severe COVID outcomes at all. And in fact, it may be that patients treated with anti-TNF have less of a risk of more severe COVID outcomes. Our data don't yet point to a protective effect, if you will. But certainly many have speculated that blocking that anti-TNF mechanism and blocking that pro-inflammatory pathway may be protective against severe outcomes in COVID, not just in IBD patients, but the general population. There was a prominent rheumatologist who wrote an opinion piece in a journal a week or so ago, suggesting that we should probably be doing trials of anti-TNF type medications, not in IBD patients, but in general patients, to prevent severe complications of the disease. I think that's a finding that needs more time and further teasing out, but I think was a surprise and potentially a pleasant one.
Yeah, and I think to state, I mean, definitively, we don't know right now, and there are no trials ongoing, as far as I'm aware, nothing that's been registered anyway that is looking at anti-TNF therapies like Remicade or Humira in the treatment of COVID in people who don't have arthritis or IBD. There are trials going on for other biologics, so particularly anti-IL-6, which is another cytokine or inflammatory chemical in the blood. They found that people who have more severe disease with COVID have higher levels of IL-6 in their blood. And so they're now trying to see whether anti-IL-6 biologics to block IL-6 actually make things better. But for now, we don't really know much about anti-TNF. But at least we're, I think so far the news that we're getting from your registry is good, that, things seem not to be worse in people who are on the anti-TNF biologics.
And the one thing I just want to point out for the audience is the type of work that we're presenting, what we call observational research, where we're observing what's happening. And the observations are kind of guideposts that helps us try to understand what's happening and to make decisions in real time that affect patients, because we don't have the answers. The definitive way to study something, if something works or doesn't work, is a randomized control study, where you randomize some people to get an intervention and some people to not get an intervention, or something else happens. And then you follow them forward to see, does that intervention is superior, and they're randomly assigned, so it doesn't, it's a flip of a coin whether you get it or don't get it. And so where really observational data becomes powerful is to give us signals to then say, this would be a valuable thing to study in a randomized control trial. And that's where, if you'll probably hear on the news, there are countless randomized control studies testing so many different therapies, because right now people are just desperate to try to find something to treat or to prevent. And so I think one of the exciting things coming from this registry, this observational research, is that maybe we'll see some signals to help define and deliver some randomized control studies for people who are suffering from COVID.